is 3, 6, and 9. And my dog is almost 13 and she can't see very well and she bumps into things, but she's always very happy. But anyway, so that's a little bit about me personally. And then professionally, I went to NC State for my undergrad. And then I did my master's and PhD here, and Dr. John Allen was my advisor. And so happy to see him. And I feel very fortunate to have Dr. Allen as my advisor as a grad student, because he had helped me make connections with people who were in the field of human lactation. And I honestly, I never, when I was younger, thought that I would be a breastfeeding professor when I got older. I knew that I was interested in pediatrics. But then I found nutrition and I became passionate about that. And then Dr. Allen introduced me to the field of lactation. And I ended up earning my IBCLC. It's at the window. Sorry. Caitlin needs to take a picture of a bird. So anyway, okay, go shut the door. Thank you. So he encouraged me to follow what I was passionate about and dive more into the breastfeeding field. And whenever I graduated, I was able to work in this position as an assistant professor and be able to help contribute to breastfeeding support throughout my job. So I've been able to do research related to breastfeeding and human milk. I've been able to do a lot of teaching and now some extension work as well. So do you want me to go into detail?
Yeah, so I think the audience would love to hear more about the work you do related to breastfeeding support and how it relates to wellness.
Okay. So how it would relate to how I do breastfeeding work and how it relates to wellness. So in my teaching and I'll start with my teaching. So in my teaching, Dr. Goodell mentioned that I teach over 500 students a year. And really what I have started to do is create these courses. So me and Dr. Singletary, who is a professor here, we've worked together on creating 3 courses. And these courses in particular, they are related to breastfeeding specifically. So anybody who wants to get their IBCLC, which stands for International Board Certified Lactation Consultant, they have to take 90 hours of lactation specific education. And they have to, that's required by the accrediting board of IBCLCs. So the 2 classes together, one is Public Health Perspectives in Infant Feeding, and the other is Clinical Concepts in Infant Feeding. Those 2 classes together provide that education that they need. And so our hope is, because we have so many students who go on to become healthcare providers, they go on to be doctors, nurses, dietitians, physical therapists, all kinds of healthcare providers. If they take these classes, even if they never become an IBCLC, the hope is that they can learn from these classes and be able to be a breastfeeding supportive healthcare provider. So that was really kind of our goal, was like, yeah, we're going to train some people to become IBCLCs. And I'll tell you about that in a minute. But the real benefit in these classes are that students can, when they go on to become a doctor and they have an opportunity to support a breastfeeding person, even if it's not them helping them with a lactation specific problem, they can connect them to resources and support, and they can, at the bare minimum, just be there to listen and be supportive and understand. So that's what we're really trying to do, is change the culture of healthcare in terms of breastfeeding support.
So can you tell us a little bit more about what you mean by breastfeeding support?
Yeah, so by breastfeeding, that's a great question, Susie. Sometimes I can talk about it and think that it's just, yeah, it is what it is. So with breastfeeding support, the way that it's really good to look at it is, let's say, you or your partner, or a friend want to breastfeed, and you're trying really hard to breastfeed, but it's just not working. Well, instead of like shaking your finger at that person or yourself and saying, well, breastfeeding is best and you need to breastfeed, and here's why you need to do it. Well, that's actually, it's not really helpful, right? It's not helpful in reaching your goals. Like with exercise, you can't just, we all know exercise is good for us, but there's so many barriers to doing it. So you can't just say, oh, you need to exercise more. Okay, what if the person has health issues that they need to overcome? What if they don't have walkable neighborhoods? What if they're working 3 jobs? All those same barriers apply to breastfeeding. I'm not sure about the walkable neighborhoods, but anyways,
Stress relief.
Yeah, there you go. Taking your baby for a walk, help them stop crying. Um, so there's so many barriers to breastfeeding. There's lack of family support, there's societal beliefs about what breastfeeding should look like, there's policies that are not supportive of breastfeeding, like breastfeeding in the workplace. We need policies where moms can have a place to pump, where they can have a place to store their milk, wash their pump parts, where they have time to be able to do that. So there's all of these barriers that get in the way. So being supportive of breastfeeding, it doesn't have to be sitting down and helping a mother figure out how to relieve mastitis. I mean, certainly that's part of it. It could be, but being supportive of breastfeeding can look like so many different things. It can be just smiling at a breastfeeding mother when you see them in public and making them feel warm and welcome where they're at. It can be, in terms of healthcare providers, they could be supportive by recognizing what the mother is going through during breastfeeding, by keeping in mind when they're prescribing medicine that the mother's breastfeeding, and the answer isn't, we'll stop breastfeeding because we're going to put you on this medicine. I mean, sometimes that has to be the answer if it's a certain medicine that can't be changed, but it would really look more like, okay, you're breastfeeding and that's important to you, and that is wonderful. So let's try to find a medicine that is compatible with breastfeeding. Anyways, that's in a nutshell breastfeeding support. I'm giving a whole talk about it at the extension conference, so I could talk about it for longer than 90 minutes, but
That's okay. So when it comes to, you shared a lot about the ways that you're going to be, or you are helping future healthcare providers to learn more about how to be supportive to parents who are breastfeeding. What kind of research have you done or are doing in the extension work? Can you talk a little bit about that in the area of like understanding what we can do to improve breastfeeding rates in our local population as well as nationally?
yeah, that's a great question. So, in terms of the extension piece of it and improving breastfeeding rates locally and nationally, um, so about a year and a half to 2 years ago, I worked with a student who she did this for her CALS honors project, where she helped me make a map of breastfeeding rates, and breastfeeding support areas in North Carolina. So we worked with a librarian named Jeff Essick, who helped us with GIS mapping. And so we made this map that had like hot spots on it for areas that were very dense in terms of breastfeeding support, and areas that had sparse support. So we call them first food deserts.
Mm.
And we identified areas in the state that were first food deserts. And as part of this extension work that I'm doing, I'm working with IBCLCs in those areas to try to help train more students in those areas. So the whole idea is that we want students who are living in those areas, who are planning to stay in those areas, who will bring the support to those areas. And so, for example, I'm not trying to train a bunch of IBCLCs in the Triangle area because we have a program already in Chapel Hill that's doing that. And a lot of them stay here in the Triangle area. And so we have more support in this area. So I am working with people in Western North Carolina and in Eastern North Carolina. So at New Hanover Regional Medical Center in Wilmington, at Carolinas East Medical Center in New Bern, and Harris Medical Center in Silva, North Carolina, which is in Western North Carolina. And these are preceptors working at these hospitals who are very passionate about teaching students and precepting students. And that's been hard to find, honestly, are preceptors who have the time and the passion to train other students to become IBCLCs. So in partnering with these hospitals and these preceptors, they're training students who will be living and staying in those areas. And then my hope is that that can increase support in those areas, and then that those students can train other students, and then we'll have more support in those underserved areas.
So you said that it's been kind of hard to find, or very hard to find, preceptors in these areas that are first food deserts. Can you talk a little bit more why that might be?
So that's a great question. And I'll be honest in that it's actually in these first food deserts, it's been a challenge in terms of finding preceptors, mostly because of just the population, like the density. There's not, there's smaller hospitals than there are in the Triangle. So a hospital may only have a few IBCLCs, and they may not have the time, to be able to dedicate to training students. However, I will say that in these areas have been the most passionate preceptors. So I think that they see in their community the need for more. Mm-hmm. And so they are passionately training these people that know that they will be their colleagues one day, and that can help spread the support.
So one of the things that you had talked about earlier was the idea of training future healthcare professionals in your classes, and this kind of is the same model. So a couple of questions with that. One is, are these preceptors reaching out to other professions, or actually it's kind of a combination. So who can be an IBCLC? Who can have this certification? And are these the only people that can provide educational support to parents?
That's a great question. So to answer the first part of your question, who can become an IBCLC? Anybody can become an IBCLC, just like anybody can become any other type of healthcare provider. But typically, what we see are healthcare providers, so people who are already some type of healthcare provider, using the IBCLC as an add-on credential, so that they maybe, let's say they're a doctor and they say, oh, I really wish I could provide more breastfeeding support. So they will do the training to become an IBCLC and take the exam. And nurses, same thing. We see that a lot. Dietitians. We've had a few SLPs as well that we've worked with.
What's an SLP?
Oh, sorry, a speech language pathologist. So So that's typically what we see is the IBCLC combined with another healthcare provider certification. The IBCLC allows that credential allows somebody to provide like more clinical medical lactation therapy. There's a greater scope of practice with the IBCLC versus somebody who doesn't have the IBCLC, which should really kind of stick more to the being supportive, but in ways that's compatible with their scope of practice, which would be, providing general education of like the benefits of breastfeeding, kind of what to expect in the hospital setting right after birth, and then, at home after birth. So more general education would be appropriate for somebody without the IBCLC, but in order to do like more complicated medical therapy type work, it would be an IBCLC. And even then, an IBCLC doesn't have a scope of practice as wide as a doctor or a nurse, obviously. So they can't diagnose conditions. They can say something like, oh, like for example, with a tongue tie, IBCLCs can't diagnose a tongue tie, but they could say, well, I think that your baby might be having a hard time latching because of a restriction, with their tongue. I would encourage you to see a speech language pathologist or an ear, nose, and throat doctor or a dentist or a doctor.
So last question before we get to the audience questions, and this one is like a big picture thing. You've been at NC State as an assistant or associate professor for 10 years?
Yep.
Yep. So in all this time that you've been doing your work, what you see as the most important outcome of the research and extension and teaching that you've done?
I think that the most important outcome is seeing the students, the influence in their lives and what they do when they graduate. And it has taken some time to see that impact, and it's taken time to develop these classes in this program, but now we've had several IBCLCs now graduate and earn their IBCLC credential, and we have one working at a local special care nursery. Actually, two of them actually, but in different hospitals. And one who just accepted a job at a pediatrician's office as an IBCLC. And we've had, so I guess seeing them go on to then practice, and I'll start to see that support spread. And that's what's really exciting to me now is to see that spread. And then I've had others who have gone on to medical school and who are now doctors. And even though they're not IBCLCs yet, they know how to support breastfeeding. So I'm starting to see that in, coming to fruition, sort of this dream. And also, we used to have an in-person breastfeeding support group. And that was really I think the most rewarding piece, because I could see firsthand the support being provided. And I say used to because the pandemic happened. And what was so beautiful about that was that some students would come to the support group, and they would come every week, and they would learn firsthand from the families. And afterwards, I would talk to them, and like on the way to school, or we go get coffee or something at the coffee shop across the street. And they would say, I just had no idea that parents went through this. I didn't know that babies were like that. And, they would help like teach the parents how to use the scale. They would bring them breastfeeding pillows, and like they would provide support in an appropriate way that they could provide support during support group. But then I've had students that were in that support group go on to become IBCLCs, who in our biweekly check-in meetings, they would say, oh, I'm so thankful for support group because I knew how to do this. I knew how to use the pump. I knew how to use the scale. I knew how to, whatever it was. So that was a very rewarding piece that I wish we could get back to one day.
One day. Well, now is the time in our show where Alex will ask you some questions from the audience. So if you are in the audience and can type in your chat box, give us some questions to not stump Dr. Fogelman, but to ask her. So Alex, take it away.
So we actually have a question from one of my fellow wellness assistants. Emma Hardy has asked, she says that she is currently in Nutrition 411, Public Perspectives in Infant Feeding with Dr. Singletary. In what ways do you think that United States breastfeeding policies either support or hinder breastfeeding in the workplace?
I mean, that's an area that I know that we're trying to make progress on. And really, I mean, it's hard because I know you do have to balance the employer's needs with the needs of the employees. But, being able to provide a supportive breastfeeding environment for the mother is gonna, like, if the mother can have her baby with her at work, or if a mother can work from home and have her baby there. I mean, like, that's what I've been doing a lot is, granted, my husband stays at home with the baby, but whether it's with the kids, but whether it's, the spouse or a partner or babysitter, whoever it is, like if the baby can be together with a mom and that can support breastfeeding, I mean, that's really ideal. I know that that's not possible in all professions. But, at least allowing time for pumping, allowing adequate leave, because 8 to 12 weeks is just not really enough time. It takes that long to recover from childbirth and to get breastfeeding established well. Anyway, I think that the United States doesn't have very good policies yet related to birth and breastfeeding. So those need to improve for sure.
But at the same time, you and I both know that the things we've seen little triumphs, right? That I'll text you every once in a while a picture at the airport of like, look, they actually have a lactation station that didn't used to be there. And so certainly I agree with you 100% that we are not where we should be, but we are making slow progress.
Yeah, for sure. And I can speak from personal experience that, my department has been phenomenal with me and flexibility and allowing me to be with my kids and breastfeeding at work and pumping at work and all of that. And, as a result, I'm a very loyal employee. I never want to leave NC State. So I think that we do need to balance employers' needs with employee needs, but at the same time, you're going to get greater loyalty when you take care of your employees.
Mm-hmm. Absolutely. Any other questions from the audience? Otherwise, I will keep asking questions.
If no one else has a question, I actually have a question. So I'm actually interested in the more legal side of things. So we were just talking about United States policies, and I was wondering, so in the field of the kind of like not lobbying, but do you see in your field any type of activism or any type of push towards policymakers to go and institute a little bit more lenient of a policy towards women who are breastfeeding in the workplace? Is there anything being done to make progress on that side of things?
Yeah, definitely. If you are interested in learning more about that, you can go to the United States Breastfeeding Committee. It's USBC. I'll see if I can put the link in the chat. They just, yeah. So I'll put the link in the chat, but they are an organization that does a ton of advocacy work related to breastfeeding. And it, yeah, that's what they do. They work with the government and the CDC and different government entities and try to advocate for, more pumping time, maternity leave, that kind of thing. And they had, well, prior to the pandemic, they would have an annual conference where people would attend in person. And then at the end of the conference, and it was always in Washington, D.C., and at the end of the conference, we would go to the Capitol and like talk to our senators, but not real, it was like their aides, but we would meet with them. So, yeah.
That is impressive. Okay, I'm glad. I had no idea that an actual organization existed. So that's really impressive.
Yeah.
I
And
don't,
in fact, to give you a little more detail about that, if you look at the Surgeon General's call to action to support breastfeeding, the USBC had a lot to do with that. They worked with the Centers for Disease Control and Prevention in helping in the Surgeon General's office to kind of help get that together.
So we have time for one more question, Alex.
okay, I guess I'm going to do first come, first serve. So we've got a question from Jonathan Allen. And the question is, what was the outcome of your research on lactation consultant availability? Is there always someone available in a hospital in the Triangle and never or seldom in rural areas?
That's a great question. And honestly, even in the Triangle area, it's hard to find support. Honestly, I think it has to do with there's so many people. So while there's more lactation consultants, there's just so many more people. And so even in the Triangle area, there is a need for support. And what we would find is that people like who are even kind of in reasonable driving distance to Raleigh or Cary or Chapel Hill, they would still see that as a barrier. Like if they lived in Anger or Dunn or Lillington, those areas, they were really excited about our support group in Fuquay because it was closer to them than it was to drive to Cary, because we were on like the Anger side of Fuquay, so we were closer to them. So is someone available in hospital in the Triangle, never or seldom? Okay. And the other thing about hospital support is that sometimes the hospital IBCLCs are only there for the babies being born there. They don't always provide the outpatient support. A lot of them will have like the warm lines where you can call and you can get phone support. Like you can leave a message and then they'll call you back. So it's not a hotline, but they'll give reasonable turnaround time to call back. And we did see a correlation with breastfeeding rates and the areas. So the areas that had more breastfeeding resources tended to have higher breastfeeding rates than the counties that had less breastfeeding resources.
Well, thank you for that. That's wonderful information. But unfortunately, that's all the time we have for today. So again, let's all thank Dr. April Fogelman for speaking with us today.
Thank you.
And I want to thank everyone for watching or coming to this interview. And I want to remind you that we broadcast every third Friday of the month at 2 p.m. Eastern Time. Our next show will include an interview with Dr. Lindsay Haynes Maslow from the Department of Agriculture and Human Sciences, and she'll be talking about her work related to SNAP Ed, the educational arm of the Supplemental Nutrition Assistance Program, which was formerly known as food stamps. So you can find more information about the Wolfpack Wellness Research web series and our previous recordings at our website. I'm your host, Susie Goodell. Until next time, be well.